Madame Tizi, vous croyez qu'on peut commencer? On peut commencer? Ok, très bien. Well, ladies and gentlemen, I am very happy to welcome all of you to today's conference on ending tuberculosis, the role of Europe in responding to growing challenges. Tuberculosis is on the rise again, an issue that is of great concern to all of us. Indeed, in 2021, 10.6 million people were affected by tuberculosis, compared to 10.1 million in the previous year, with 95% of tuberculosis deaths occurring in low and middle-income countries. As you are well aware, the war in Ukraine and the COVID pandemic have had drastic impacts on the fight against tuberculosis. In Ukraine, the war has resulted in a significant increase of the number of people living in poverty and displacement, which has made them more vulnerable and susceptible to contracting tuberculosis. The ongoing conflict has also caused disruption to the Ukrainian healthcare system, including a shortage of medicines and healthcare workers, which has made it difficult to provide essential care to tuberculosis patients. Indeed, a report from Physicians for Human Rights indicates that from February 24, so the beginning of the invasion, until the 31st of December 2022, there have been 707 attacks on healthcare infrastructure and healthcare workers, which adds up to an average of 2 attacks per day. It's difficult to find words to describe those atrocities. It goes without saying that the COVID pandemic has also had a negative impact on the fight against tuberculosis. The pandemic has diverted resources away from tuberculosis programs, resulting in decreased funding and a reduced focus on tuberculosis prevention and care. Indeed, tuberculosis funding dropped by $600 million from 2020 to 2022, now amounting to less than 45% of the $13 billion annual target agreed upon at the 2018 high-level meeting of the United Nations. As a consequence, one can clearly say that the world is off track to eliminate tuberculosis by 2035. As it is always the case, the poorest and most vulnerable people will suffer the most. To discuss this, and in order to get better insights in what is happening on the field, we have invited a wide range of experts. I am particularly happy to welcome member of Moldovan Parliament, Dan Persiun, who co-chairs the Health Commission of the Moldovan Parliament and who is co-chair of the Eastern Europe and Central Asia region for the Global TB Caucus. Additionally, I am happy to welcome Anton Bazenko, who is Ukrainian civil society representative and tuberculosis survivor, as well as Andrei Klapikov, who is director of the Alliance for Public Health in Ukraine. To hear about the European Commission's approach, we invited Gabriela Fezus, who is head of Unit for Social Inclusion and Protection, Health and Demography at DG INPA, and board member of the Global Fund for the European Commission, Belgium, Italy, Portugal, Spain constituency. Many thanks to all of you for your participation in today's conference. As members of the European Parliament, we have a responsibility to address these issues and work towards the goal of eliminating TB by 2035. We must work together to ensure that TB remains a priority, even in the midst of ongoing conflicts, pandemics, and other challenges. This means increasing funding for TB prevention and care, supporting healthcare workers, and promoting research and innovation to find new and effective treatments. And with that, I leave the floor to today's moderator, Alicia Matusevic. Thank you, but I don't give the floor, not before having welcomed the Vice President of the European Parliament, Mark Angel, who will draw the conclusions at the end of our conference. Thank you so much. Mrs. Alesia Matuzic, you have the floor.
Is it working? Should I? Okay. Thank you so much, dear Charles. And I want to remind you that today's event was made possible thanks to your leadership, dear Charles. And let me kindly remind that Charles is a member of European Parliament from Luxembourg who has been committed to development cooperation for decades through his position as Minister of Cooperation in Luxembourg and now as a member of the Development Commission of the Parliament. He is the Vice Chair of Friends of the Global Fund Europe for European Union, Luxembourg and Belgium. And thank you so much for your kind reminder on why tuberculosis is a critical issue for public health and development in the European Union. Thank you so much. And let me kindly introduce myself. My name is Alesia Matisevich, and I'm here as a representative of Ukraine as well, because I'm a Ukrainian citizen. And for now, I'm living in Portugal for the last 1 year and a half. As well, I'm the regional manager for Eastern Europe and Central Asia countries in Global Tuberculosis, which is the unique organization of parliamentarians who are tackling against tuberculosis. I'm happy to provide you with additional information whether it will be needed. So please approach to me or through the Delphine. I'm happy to discuss further this. Let me welcome all participants here in the room, as well as Honorable Dan Perchun online. Thank you so much for your time joining. And I remind you that we have a possibility to ask questions through the chat box. We will have a Q&A session at the end for 10 minutes. But for now, let me start with remembering how Andrei Klepikov once said and quoted our head of the Global Tuberculosis Organization, Lord Nick Herbert. You once remembered how he started his speech during the UNHLM 2018. That no one of us should not have been sitting here, because TB is a preventable and curable disease. And we all should remember that with a good cooperation, with a good approach, with partners, we all can tackle this disease. So for now, still it's 2023, the next UNHLM is coming, but we are completely off track. For sure, also because of the COVID pandemic, because of the ongoing conflicts in Eastern Europe region, we are off track, but we should not take it as an excuse. We need European Union parliamentarians to champion an ambitious commitment for this UNHLM, and this meeting is a great opportunity for this. World TB Day, we know that World TB Day is coming, and the theme of World TB Day is, yes, together we can tackle TB. We all know that our current statistics on TB is very horrible, and in 2021, tuberculosis killed 1.6 million people. In 2022, numbers already increased, also because of the COVID pandemic, but 2023 is a key moment. It's a time to renew and accelerate the commitments towards ending TB. European Union has made strong commitments recently towards global health, an ambitious pledge to the Global Fund to fight HIV, TB, and malaria, and the launch of the Global Health Strategy. Today's event will focus on the challenges in the fight against TB, AMR, the Russian invasion of Ukraine, and how the European Union is responding to those challenges. With a slow transition to the next speaker, I would like to remind you that last year, the European Union Commission took several important decisions for the fight against TB. First, in September, by pledging 750 million euros to the Global Fund during the Replenishment Conference in New York, and then in November by presenting the EU Global Health Strategy. To hear more about the EU's commitment to ending TB, we are honored to welcome Ms. Gabriela Fezus, Head of Unit Social Inclusion and Protection, Health and Democracy, DG International Partnerships and Board Member of Global Fund for European Commission, Belgium, Italy, Portugal, and Spain constituency. A lot of countries you are covering. Thank you so much. And please, the floor is yours.
Thank you very much. And in fact, I'm sitting in the board meetings next to Andrei. So I'm glad to be seated again next to him. So thank you very much for inviting the European Commission to this event. Unfortunately, TB remains, as you said, a deadly disease and a preventable one. And although progress has been made, still a lot needs to be done if we want to reach the sustainable development goals. We are very glad that the high-level meeting on TB will take place in New York, and sincerely hope that that will also help reaffirm commitments to the fight against TB. And as the Honourable Member of Parliament has been saying, also we are of course very concerned that TB disproportionately affects poor and marginalized populations, and it calls for tackling inequality in access, prevention, care and treatment. The impact of COVID-19 has also been mentioned. Unfortunately, it also led to diverting human and financial resources from the fight against TB and having a catastrophic impact. At the same time, COVID-19 also spurred innovation, prevention, diagnostic, treatment, and community outreach that helped more people to be basically treated and cured. The European Union indeed is very strongly committed to the fight against TB. It is a long-standing supporter to the Global Fund, and as it has been just mentioned by Alessia, we are very glad that it was possible that a pledge of 715 million euros has been made by President von der Leyen, and also Team Europe, so the EU and member states together have pledged 4.5 billion euros to the fund, which represents around 30% of overall resources for the fund in the period 2023 and 2025. And obviously what is very, very important for us indeed that the Global Fund continues to fight the inequalities, also to continue to strengthen health systems. And as it was also mentioned, the European Commission presented a new strategy for global health last November. This strategy is still being debated currently by the EU 27 member states. And in this strategy, there's a very important guiding principle, which has been identified to improve equitable access to a full range of essential health services, from health promotion to disease prevention, affordable quality treatment, rehabilitation, palliative care, to fight communicable and non-communicable diseases. And the strategy also underlines that the European Union should continue to lead the fight against a range of communicable diseases, including TB, AIDS, malaria, but also others such as polio or neglected tropical diseases. So, as I said, the strategy is being debated in Council. It has been well received also by EU member states and stakeholders, and we are very glad for the extensive input we have received from civil society organizations, some of them present today in the room, and also from a range of other actors. And of course, we also need to strengthen research alliances as well when it comes to fighting such diseases. Another important priority in the global health strategy is indeed antimicrobial resistance, and where we are committed to work more closely with organizations such as WHO, WHA, UNEP, as well as FAO. And also we wish to see some concrete provisions on antimicrobial resistance in the text of the pandemic agreement, which is currently being negotiated. This is an important priority for us, and also to support the development and access to innovative medical countermeasures as well to address antimicrobial resistance. I mentioned the whole area of health system strengthening. This is a very important priority for the European Union, and we feel that resilient health systems are the best defense when it comes to being prepared for pandemics, and especially focusing on areas such as primary health care, but also workforce, among others. Of course, the strategy itself focuses a number of regions, including Africa, also of course Latin America, and importantly, Europe's neighborhood. And the European Union is actively working with partners in the neighborhood, in countries, Ukraine, Moldova, the Western Balkans as well, to help raise healthcare standards and also supports candidate countries and potential candidate countries to align health legislation with EU health law. But it has also mobilized the European Center for Disease Prevention and Control and the European Medicines Agency as well to work together with candidate countries who are also now members as observers of the health security. And when it comes to Ukraine specifically, the European Union is very committed to support Ukraine in the current challenging situation and of course beyond as well. And we are also very glad that the global initiative such as the Global Fund is also intervening very actively in Ukraine. So I would stop there. Thank you very much again. And I would like to already express my sincere apologies, but unfortunately I have to leave earlier. But looking very much forward to the discussion. Thank you.
Thank you so much, dear Gabriela. I would like to welcome as well a member of European Parliament, Isabel Vizela-Lima. Thank you for your time. We recognize that it might be challenging because you have a lot on your plate, but thank you so much for being here with us. And thank you, Gabriela. We welcome the leadership of the European Union on global health, and we encourage different institutions to work with member states and key stakeholders to prepare for UNHLM to take ambitious actions to make this disease part of history. We will now start our roundtable, and we are privileged to have a rich panel today to discuss the challenges of ending TB in the context of the AMR threat and the Russian invasion of Ukraine. Let's acknowledge this moment to recognize that a lot of death because of TB could be prevented if the political decisions and the proper cooperation between partners would be made on time. And let me kindly welcome our panelists here, Mark Angel, Vice President of the European Parliament, Dan Perchun, who is with us online, co-chair of Global TB Caucus in ICA region, head of Moldovan TB Caucus, and head of the Health Committee in Moldovan Parliament. Andrei Klepikov, Executive Director of Alliance of Public Health. Anton Basenko, Ukrainian Civil Society Representative and TB survivor. Diane Stewart, Deputy Director, External Relations and Communications Division and Head, Donor Relations Department at the Global Fund. Dr. Vincent Césaire, Director of FARES. And we will start the discussion for about an hour and we will open the Q&A session to the audience online, and for sure our preferences will be offline. We will have 10 minutes for Q&A, 5 minutes for each speaker. Andrei Klepikov will have 10 minutes because he came all the way from Ukraine directly and namely for this event. So we would like to recognize this. I would like to remind you that we are very strict on time, so I'm sorry in advance if I will need to interrupt speakers. And I'm very happy to start the discussion. I hope that you're happy as well. Dear Dan, are you happy to start the discussion? Because my first question will start with you. And I would like we all heard in the opening remarks that the world is completely off track to end TB by 2035, which was our common goal as set in the WHO strategy in 2014. Why, in your opinion, do you think we are so much off track? As a parliamentarian and a member of Global TB Caucus, what do you think we need to put the world back on path to eliminate this disease? And before you will start to answer, dear Dan, I want to recognize your efforts that you are putting for tackling TB. And you are one of the youngest members of Global TB Caucus, but as well one of the most active one in Global TB Caucus. I want to recognize your achievements which you are doing in Moldova in cooperation with civil society and TB affected communities. Thank you so much. And from your perspective, it will be really glad to hear your opinion. The floor is yours. Thank you. I think you're on mute if you are speaking.
Thank you very much, Alessia, and thank you everyone for organizing this excellent event. It is a great opportunity to draw some conclusions and discuss the way forward to continue advancing this agenda. I think there are multiple reasons why we are off track, but I think it is very good that we all recognize that the pledges that have been made in 2019 regarding the funding for TB, as well as the targets that were set then, are not being met, recognizing that in some sense is already a step towards the solution. We have to say that there are multiple crises that have affected countries in EAC region and globally over the last couple of years that have definitely made it more difficult to achieve the ambitious targets that were set. COVID is, of course, one, and it is undoubtedly played a major role in dealing with the TB. And I think it was felt across all countries equally. And now with the energy crisis, with the war in Ukraine, with the Russian invasion in Ukraine, additional strain has been put on public budgets to address the outcomes of this crisis. In Moldova, for instance, to give you an idea, we have faced inflation of 35%. Last year, energy prices have risen sevenfold. Therefore, of course, public finances had to be mobilized, international support had to be mobilized to help the population to address these multiple difficulties with polycrisis that has occurred. Then, of course, Ukraine is in a particularly difficult situation with the war going on and all the destruction happening there. And clearly, in this context, to be able to reach those targets and even the financing needs is a challenge in itself. It has added to the complexity of the issues. At the same time, at least from Moldova's experience, I do have to acknowledge that the TB issue is not sufficiently put on the public agenda, even in a country which is one of the, unfortunately, the leaders in terms of TB incidents. There is insufficient public discussion about it, and it is clearly not a hot political topic. That's why the activity of the Global TB Caucus is so important, because it brings parliamentarians together and it asks of parliamentarians to acknowledge the issue and to lobby actively for identifying sufficient resources and for keeping governments accountable to reach those targets. So I think in these difficult times, this becomes even more important, that representatives of the people essentially are aware of the challenges and do recognize that TB is an issue that needs to be addressed. We will be conducting the regional EACA summit in Tajikistan on the 16th, 18th of May with the title Future-Proof Eastern Europe and Central Asia TB Summit. We will be bringing regional leaders together with key stakeholders and partners from affected communities, civil society, academia, and international organizations to drive that renewed effort in TB. And of course, we are inviting everyone who would like to join us in that discussion. Again, going back to essentially the issue of advocacy and putting this issue on the public agenda. It is not there, not least because, as previous speakers have mentioned, the most affected are the poor and vulnerable populations, and unfortunately not always they have the voices, the power, the advocacy capabilities to make themselves heard. and to ensure that sufficient resources are provided and are going their way. And this is why, once again, the role of parliamentarians is extremely important in representing these vulnerable groups, which need political support, political recognition, and empowerment.
Thank you so much, dear Dan. Sorry, you want to conclude?
I just wanted to mention that migration is another issue which is specific to our region and which complicates issues further. And now, of course, with the influx of refugees, an already complicated situation is made even worse. I just wanted to acknowledge this point as well. Thank you very much.
I want to ask a follow-up question about TB and migration a bit later, with your permission. Thank you so much, Dan. And thank you for recognizing the work of Global TB Caucus. I can feel that you're also a bit overwhelmed with everything what is going around, but thank you for finding your time to join to this event. My next question will go to Vincian, and we all know that resistance is one of the key threats to eliminating TB. Can you tell us why we should be concerned about it for TB and beyond it for the health security of the European Union? Vincian?
Yes. So first of all, be it sensitive tuberculosis or resistant tuberculosis, the disease itself has its specificities that is very difficult to control it. First, there is a big reservoir of people already infected, but not yet sick. Secondly, at the beginning of the disease, the symptoms are very mild, and the people take time to seek for help, and for the time being, they can transmit the disease because it's an airborne disease. And then the diagnosis is quite complicated also, especially in the Occidental EU countries, because there are not so many TB anymore, so the doctors, they don't think right away about tuberculosis. And of course, all of this is complicated when it's a drug-resistant TB, because then you need also to do a rapid DST. They are not available everywhere, and you need them anyway to offer a proper TB treatment to the drug-resistant TB cases. And besides this, the treatment is very complicated. And here I speak about only the medical aspects, but there is also the fact that TB is very determined by the social determinants. So in EU country, at least, is the most vulnerable people that are affected by TB. And so that complicates the things because they don't have so easy access to the health care. And also to comply to the treatment that is very long, it's 6 months minimum, it's also difficult. So they can't stop the treatment to take it erratically, which might and then further develop resistance TB. And so the drug resistance TB by itself, it's a problem because it needs a complex treatment that is worse than the sensitive TB. Now we have new drugs that make the treatment of drug resistance TB easy, like bedaquiline, delamanid. But when you don't have a right to apply to global funds, like in our countries, these treatments, they are very expensive. For 1 6 months treatment regimen with bedaquiline, we speak about 25,000 euros still. So, and now, of course, with the war crisis and the movement of migrants, all this, the migrant phenomenon will, of course, prevent a better control of TB in Europe.
Thank you so much. I totally agree about the social determinants. That is why we need to have this multi-sectoral approach in tackling TB. So to have a unified cooperation in these regards. Good that you've mentioned about the medicines. I would like to ask a bit later some other questions about additional medicines like Pretomani to the new one. But for now, let me pass the floor to Mark. And as UNAIDS champion, you've raised your voice at the European Parliament to address the inequalities that threaten specific communities' dignity and access to health. Why, on your mind, is a rights-based approach critical for the fight against TB, and how can the European Union support this approach? Dear Marek.
Thank you very much, Alessia, for that good question. But before I answer, I would like to thank my colleague and friend, Charles Goerens, for his commitment today on supporting the Global Fund and the Tuberculosis Day. This is very important. And he was already, before he was a member of the European Parliament and as a Minister of Development in Luxembourg, very, very much committed to that. And he continues this here. So thank you very much, Charles. This is important also for me, as I'm from the HIV/AIDS world. I was an AIDS activist. I was then UN AIDS ambassador for the 90-90-90 targets, and now I'm the ribbon leader for the 10-10-10 societal targets. And HIV/AIDS, tuberculosis, malaria, and many other diseases, and COVID, it's the vulnerable, the social determinism, it's proven. So I think this human rights-based approach is very, very much very important. I'm very happy to hear that the Commission dedicated 715 million to the Global Fund, and also that Team Europe has even pushed this to 4.5 million. And we can be proud as European that this is 30%. And this is money, and money is very important, and we need the money. I see in the HIV fight where money went down, we couldn't reach our targets. So money is important, but money is not all. There's also this human rights approach, which is important, and therefore you need also political support to push that human rights approach. If I just go to the field I know better than is in HIV, we have to defend the key populations, because they are the ones who suffer, and they're often linked to human rights issues, to discrimination and stigmatization, and therefore we have to tackle that. And I think Winnie Byanyima, the new executive director of UNAIDS, has very made clear in her new strategy that we can only aid AIDS by 2030 if we end inequalities. And this angle of ending inequalities, I think, is very, very much important. And therefore, for me, there's my three favorite SDGs. It's 3 and 5, of course, health and well-being, but also gender equality. This is also very important, that we need to have in health setting some more gender adapted or gender sensitive approaches. This is also something very important, especially because women and girls are often in the most vulnerable groups. So this is something I think we as European Union, we should push also on that aspect of the gender equality and this gender sensitive, and then also make sure that no discrimination is allowed in health settings. And therefore, I launched a campaign in Europe. This is related to HIV/AIDS, but we can see it in other sectors. There is a global coalition against discrimination and stigmatization in HIV. And there was no European country member, except for Ukraine. Bravo, bravo, yeah. Ukraine, bravo. And what you see that map, and then you say, are we so good that we don't have discrimination, and we want to go and give lessons to others when we travel to Africa, etc. And therefore, I was very happy that the Luxembourg government was the first government to join, the first EU country to join this global coalition against stigmatization and discrimination, and others are following. And I know that the Spanish presidency is going to work very hard on this too. Good for them, and I hope we can motivate other member states to join this important global coalition and partnership. And here again, you see this rights-based approach is very, very much important. So money, yes, rights. And then you mentioned also something very important. It was the gentleman online. But then, yeah, awareness raising. If I see how little awareness is among politicians when it comes to my field, I know best about HIV. If you would ask all the MEPs, do you know what PrEP is or PEP is? I think maybe 10% would know what it is, etc. So we need, and also that you can be, if you have a good ARV treatment, that you can be cured, and that we need to ensure adherence to treatment. All these things, there's totally no awareness of this, and also here we need you, we need civil society, we need the academics, and we need politicians to work together. And therefore, once again, thank you for inviting me here, because for us politicians, Charles, and I don't have to tell you that, and also also Isabel, having this contact with the with civil society, with the academic world, and us politicians and the people who work around us, the Commission and the Parliament officials. I think together we can be strong and have some result. This is also very important for me. Tuberculosis and HIV/AIDS. I was in many countries where we discussed the co-infection. Also, this is also an aspect which is not negligible, not to ignore. Yeah, sorry. And therefore, I'm very happy also to be here today. And I wanted to say a last thing. I forgot, but I'll say it later on.
Okay, thank you so much. In the sake of time, let me thank you for your presentation. And yeah, I agree with you that inequalities and stigmatization is kind of not like, I cannot say that it should not be an important issue for European Union, but recently I've heard what Teresa Kasayeva said, the director of WHO for TB program. She recently participated in the preparations for UNHLM with co-facilitators. And when she raised this issue of stigmatization and inequalities, a lot of partners were surprised that it is still there. And we should talk, like in Eastern Europe and Central Asia region, we are talking all the time about stigmatization. But it appears that for European countries, we need to talk even more about this. And thank you so much for pointing this out. And I would like to forward the next word to Andriy, and to recognize that as Mark spoke about rights and dignity, we are recognizing and emphasizing that Ukrainian citizens' lives and rights have been under threat since February 2022 and even since 2014. Can you tell us how the Russian invasion of Ukraine has impacted people's access to tuberculosis diagnosis and treatment, and how your organization, the Alliance for Public Health, has reacted and adapted to these new circumstances? Just before you will start your presentation, I would like also to recognize the efforts of your organization, which you are doing for Ukraine. And I know, and I've seen a lot of work, charitable work, what you are doing, not just for TB-affected people, but for other people who need this support. And this is incredible how you are managing to do it in such circumstances. And yeah, just to thank you for that. So the floor is yours.
No, thank you, and thank you to European Parliament, European Commission, and European Union overall for such critical support for Ukraine. Next slide. I have a few slides. I would like to say that it worked. There was no outbreaks in TB because of collective efforts. Civil society, community, politicians, international players, and donors, including the Global Fund. When the war started, actually, Global Fund was the first donor, reacted quicker, more effective, and more agile to the changing situation. Consequences of the war for TB system are so dramatic. So in 9 regions, nearly half TB infrastructure was affected. The next slide shows, it's not this picture from internet. This is the real hospitals. This is the real hospitals on the left, for example, in Mariupol and in Kherson, destroyed to nothing. On the right side, you see the apartment of our social worker destroyed, and now she lives in a bomb shelter and still continue to work there in Nikopol. The next slide shows that how dynamic situation is. We moved 7 million people moved within Ukraine, mostly from orange side on the east to western side, with a huge number of risks, including TB risks. You know the expression, TB is the best friend of any war. Unfortunately, Ukraine is not an exception. And next slide shows how we responded. There are many figures here, but I would like to highlight maybe that in Ukraine, during 1 week of one working week, just 1 week, we identifying more TB cases than in countries like Sweden for the whole year. So it's a 52 times difference. Yeah, 1 week equal to the whole year. So this is demonstrate intensity of the work happening on the ground and resilience, because next slide shows you see the women with the bicycle. When there was a fuel crisis, actually we provided NGOs with the bicycles, and they did delivery of medications and collecting sputum with bicycles, and some even with feet. So it was really huge, enormous effort from civil society, community workers, in addition to the doctors, to sustain the program, to avoid any treatment interruption. And next slide shows that when the war started, you see a drop, well, on the diagram with the green bottoms on March and April, with substantially lower identified cases. But even in 2 months, we got back to our regular work and even did more than before the war. So it's also important lesson that we work not only within the country, but abroad, helping TB patients abroad. And sometimes they are lost even in developed European countries, not familiar with MDR TB or not having enough doctor. So they prefer to call the Ukrainian doctors and to ask to translate their records in countries like Poland, Germany, Baltic states. And it's important that on Ukrainian side, we, next slide, we quite progressed in policy decisions. For example, Ukraine was first country adopting new treatment guidelines by WHO. Number one. So we were, that demonstrates that sometimes even European countries are a bit behind, and it's really important to move forward. It's like on the front line. You cannot win the war with old weapons. You cannot stop TB using old treatment regimes. It's clear, no other options. And finally, I would like to say that it's, Mark, what you said about HIV equally applicable to TB. Human rights, gender-tailored programs, eliminating policy barriers. It's critical that key populations there, sometimes even more neglected, homeless people, people without documents. So I would like to conclude final slide with thanking again. Critical support from EU is a success for all of us. And we will win the war, we will stop TB.
Thank you so much, Deandre. And for sure, this critical support which you are providing to people who need it is very important now. We all would not be able to do it without our partners' cooperation and support. And it's good that you've mentioned about support to civil society organizations. Also, I would like to mention that in European Union, there is not such a strict regulations for CSO support, national regulations like it is now existing in Ukraine. And for the proper treatment, to avoid TB treatment, it's good for European Union members to think how to implement national regulations for civil society organization support. My next ask will be to Anne. And we heard that Andrei mentioned numerous challenges that are unfortunately not so common, not so unique just to Ukraine, but are often common in war conflicts and more generally challenging operating environments. The Global Fund gets replenished every 3 years and tries to make long-term plans with partner countries. How do you think, from your perspective, does it respond and adapt to those changing contexts? Yeah.
Thank you so much, Alessia. It's always a little overwhelming to speak after Andre because the work that you and the civil society partners are doing in Ukraine is unbelievable, and we're very proud to be your partners. I think the points that he made are really a real illustration of the challenges we have in fighting these infectious diseases. The only way you win against these epidemics is by reaching all of the vulnerable people everywhere, wherever they are. And that means that we need to operate in all environments, whether it's easy to reach those people or whether it is more challenging. And so indeed, the Global Fund does work in many challenging operating environments, whether it's because of instability caused by war or indeed by natural disasters. And unfortunately, what we're seeing is more of both of those things everywhere in the world. So our job is getting more difficult. In particular, I think we have considered the ways in which we need to work in order to reach those people. So as we see at the moment, about 30% of the environments that we operate in are extremely difficult or challenging, and that is growing. And about 25% of the disease burden that we see globally is in these challenging environments. And as I say, that is also growing. So how does the Global Fund go about doing this? Well, firstly, we make sure that we invest equally in these environments. So we've invested over $15 billion since the beginning of the Global Fund in 2002 in these environments. And since 2014, we established an emergency fund so that we could be a little bit more nimble and invest more quickly when crises break out. What we find, and Andre, you illustrated this very well, is that in conflict situations or in natural disaster situations, floods, earthquakes, other kinds of environments, health systems come under extreme pressure. And if the health system is fragile to begin with, then the crisis exacerbates that. One of the reasons Ukraine is doing so well is that actually, heartbreakingly, before the war, Ukraine was making incredible progress against HIV and TB. And it was those systems that we were able to quickly build on and adapt after the war broke out. And that's one of the lessons, right? The Global Fund is able to be pretty flexible in the face of a crisis. And thank you, Andre, for mentioning the fact that we were the first donors to make money available. In fact, that was also true of COVID, and I think you benefited from the COVID money as well. We had money out to countries and flexible funding available to countries 7 days before the Global Fund, before the WHO declared a public health emergency for COVID. So in fact, we saw it coming and we said to countries, use this money as you need it. We also make sure that when we're working in these kinds of environments, we work with the first responders. So again, it was very well illustrated in Ukraine, but civil society is often the closest to the communities and the most flexible. So what we've done in Ukraine is augment the financing that was available. Since we started funding HIV and TB programs in Ukraine, we've dispersed over $850 million to Ukraine. But we quickly augmented that with both COVID money and emergency fund money in order to make sure that we could continue to operate. And we also made sure that we were able to spend money on whatever they needed. So in fact, the Global Fund is funding generators in Ukraine in order to allow the regional labs to continue to function even though they don't have power. We're funding the fitting out of mobile vans so that health systems can go to where the people are, and you saw how many health facilities have been destroyed. So in the absence of those facilities, we're funding the mobile vans. And we're also trying to make sure that the funding follows the people. So whether that is displacements in the region or displacements across the border to Moldova, and our colleague in Moldova will know that we've augmented the funding to Moldova with emergency funds also to take care of the people who have crossed the border. So I think all of those things are important, the flexibility, the speed, and supporting people with what they need. including, and this is my last point, including psychosocial support. Andrea and I were talking about this just today, that treatment is not enough. In fact, especially in these very unstable and difficult situations, in order for people to really benefit from and have good outcomes from treatment, they need psychosocial support, food, care packages, and we're quite happy to invest in those wraparound services so that people actually are able to benefit from the medical support that they are provided with.
Yeah, I totally agree with you. Thank you so much, dear Jan. All this work can be done in Ukraine as well with the support of Global Fund. We are very grateful for this. I'm glad that you are in touch also with Dan, maybe on some issues in Moldova. And my next question will go to Dan again. Regarding refugees, I promise that I will come back to you with this question. And there's a statistic data that nearly 750,000 refugees have fled to Moldova since the Russian invasion of Ukraine. What are the challenges of refugees with TB and how is the health system coping it in Moldova? Please,
Yes, indeed, there were about 750,000 refugees that passed from Moldova. Close to 100,000, perhaps a bit less now, that have decided to stay in Moldova for a longer period of time. Currently, we have seen a stabilization and a reduction in the inflow of refugees, but clearly for a country which is in total has 2.6 million people, such a rapid increase in population of about 3 to 4% has proven to be challenging, and with regards to the provision of TB services as well. Indeed, we do have to acknowledge the generous help that has come from Global Fund when needed, by 1.2 billion that was disbursed to provide for these services, that we are very, very grateful for. And I think, again, where most acknowledgement has to be given is to civil society involvement. They have been instrumental due to their excellent connections to their partners in Ukraine, but they have worked over the years to be able to identify and continue the provision of services for Ukrainian refugees with TB that have ended up in Moldova. I would just mention that from the 1st of March, Moldova has launched the temporary protection mechanism, has opened it for Ukrainian refugees, which means that they previously did as well, but now through the temporary protection mechanism, they will have long-term free access to all necessary medical services, be it related to TB or any other medical services they might need. I think the latest statistics on the number of TB patients was somewhere around 100 people that have been identified or had TB and have been identified here in Moldova. Thank you.
Thank you so much, dear Dan. We appreciate the statistics information and the help which Moldova is providing to Ukrainian refugees. And I would like to refer my next question to Anton. You have been a long-term advocate for the Global Fund and in the fight against HIV and TB. You participated in the first UNHLM 2018, and I recall just today I got a notification from my Facebook that 5 years ago we all seated together in Ukraine, and with Enrique Lepiko we were celebrating the successful launch of campaign. We lightened our Ukrainian parliament in the red color to acknowledge and to bring more attention to this day in Ukraine, and hopefully soon we will be able to sit again all together to mobilize national TB stakeholders in Ukraine. But for now, 5 years later, how do you think back at the progress from that meeting? What have we learned and what do you expect from the upcoming HLM in September?
Thanks, Alves. I think we should make a deeper dive into the, let's say, more retrospective and the background of my life, just to give a bit of sense of who I am and my linkage with all these problems and issues. So I'm a person who used drugs more than 20 years, and I'm a person living with HIV so far, like almost 20 years. And let's say, in certain sense, it was not. It was not. It was quite maybe expected news for me to find out in 2003 that I have HIV, hepatitis C, and then finally a suspicion on tuberculosis. But you know what? I'm always saying that I'm honored to be, one of those 50 million lives saved by the Global Fund. But I can say that Global Fund saved my life few times, and every time it was really timely, let's say, and very properly. So at that time, when I was diagnosed with HIV and hepatitis, I was still an active drug user, and to get antiretroviral therapy, because at that time we used old guidelines. You used to wait until your CD4 cells drops to 200 level. Of course, this level is of course provoking co-infections and opportunistic infections. So that's why my linkage with TB at some point, there was a suspicion on TB, like there was big discussions whether I need treatment or just prevention. The diagnostics at that time also was not so, let's say, good as now. So, and being originally from Kiev, which is a big city, and when you're an active drug user, and when the HIV clinic is in one area, TB in completely another end, and you also, you were in need to provide your, basic needs, and also kind of find drugs, etc. So it's really difficult to get access and to think about your health, and that's where Global Fund came with harm reduction programs in my life, and with needle and syringe programs, and later with opioid substitution therapy. And actually that really helped me to survive with finally just a prevention therapy, TB prevention therapy, before I started ARV. And then Global Fund came with antiretroviral therapy in 2005. And actually, now I'm just analyzing, and I understand that, yes, that was maybe really miracle at some point, but yeah, I can be here and raising voices of the communities. And the last and the most, I think, important investment of the Global Fund is the communities itself, because the first examples I brought are just example of the personal, like one of, let's say, 350,000 estimated people who inject drugs in Ukraine, right? But talking about the communities broader, TB community, drug users, sex workers, migrants, MSMs, the investment in the capacity building and the empowerment of communities, that was really proper and also timely investment of the Global Fund. And today we have very strong networks in Ukraine, the Ukrainian Drug Users Network, TB People Ukraine. And we also, of course, contributed at the times of the war to all this humanitarian peer-to-peer response. But coming to the point, to the HOM, sorry for a bit long introduction, that's exactly where this investment played a role, because it's also helped us to increase our capacity as an activist. And actually, my first HOM experience was 2016 UN HOM on HIV and AIDS, and it was not the first HIV/AIDS high-level meeting. That's why, of course, everything was. I was a member of a task force, so I was involved directly in the preparation of HOM, and of course, it was. You can see that it's more organized, structured. When finally in 2018, when it was first ever, as far as I remember, TB high-level meeting, it was completely other impression. Of course, we used the experience of HIV, HOMs in the preparation, but to hear the rhetorics of member states and to see the community's voice and civil society voice, it was completely different feelings, between the HIV and TB. And also, I was always, surprised why it's different and it's not one HOM. So that's why, first of all, my expectation, and I think it's a great solution that this year we have not only high-level meeting on tuberculosis, but it's three in one with pandemic prevention, preparedness and response, and universal health coverage. This is really what what we really need, because we always talk a lot about integration of things, and that's exactly the proper opportunity. So our expectations is, of course, political will. We know that there are beautiful political declarations as an outcome of these high-level meetings, but then when it's coming to implementation on the country level, where it all goes, it's a big question. Of course, we are always saying about funding not as such proper funding to fight the diseases, but also investment in the communities and the civil society. And of course, specific things like, of course, medicines and proper diagnostics, timely, affordable, modern, things like mental health, quality of life of people living with TB or HIV, whatever, communities, online and digital innovations. So finally, COVID and war in Ukraine taught us that it's not only, time of problems, but it's also window of opportunities. We realized that very good, and I think that we really have to use this opportunity. I mean, high-level meeting on tuberculosis and all these three on maximum. And you can see the Ukrainian national short named Vyshyvanka, which is a very important symbol, as you can say, spiritual symbol for Ukrainians. And with this symbol, we really, as Ukrainians, we are trying, to share the spirit of unity and spirit of dignity and win to end tuberculosis. Thank you.
Thank you so much, Denis. Thank you so much for sharing your personal experience. I know that it's always hard to share something personal, but we really appreciate that you made this acknowledgement to your experience and that you are so open to share it with us. My next question will go to Vincian, and we know that, what other progresses have we made in the last 5 years toward the development of a transformative tool to end tuberculosis? What, on your mind, do you expect or hope from European Union to accelerate this development?
Okay. I think the last year have see a lot of progress about the medical care of tuberculosis. We have new diagnostic tools, even the whole genome sequencing that allow to do a full drug sensitivity testing for tuberculosis, so we can see the resistance to first and second line TB drugs. And also we have these new drugs that permit to shorten the treatment of drug-resistant TB. But I think if we just limit ourselves to the medical means, we are not going to be able to control TB. We really need to work on the social determinants. I repeat it. So in our country, we know that is the most vulnerable people that are affected with TB. We speak about hard to reach, hard to treat people, but actually the problem is the healthcare system that is hard to reach. So I think there is a huge need to reinforce the healthcare systems to ensure a universal access. And it's not only in a medical point of view, but also in a social point of view, etc. There have been a lot of promise that we need to reinforce the health system after the COVID pandemic. And now, at least in Belgium, I see that already these promises are forgotten. We don't find nurses to work in the hospitals. And also there is digitalization, so more and more people, they don't know how to get healthcare. So I think there is really a need to reinforce a healthcare system. And another thing that is the experience of Belgium, we are a small country, very few with few TB patients. So no pharmaceutical company is interested to register the TB drugs in Belgium. We have only one. And so we face very often a rupture of rifampicin, for instance. And I think it will be useful that in the level of EU, we have a global supply for EU countries.
Thank you so much, Vincian. And again, we are raising the question of the need of unified approach to tackle this disease. As Anton said, it's good that universal health coverage, which is promoting this approach, is coming up. And this year, let's see how it will be during the UNHLM on TB itself. My next question will go to Mark. And The European Commission presented last November its global health strategy, the fight against antimicrobial resistance through a One Health approach, which is a part of the guiding principles of this strategy. The strategy sets a high ambitions for the EU as a leader in the global health to match the existing EU leadership funding, as shown by the ambitions pledge made to the Global Fund. Where on your mind and how do you hope the European Union can have a significant impact on global health?
First of all, I think the European Union can have a very big impact on global health. It continues also funding global health and talking about it and trying to gather like-minded other like-minded big players or continents or bigger countries in the multilateral arena to speak in one voice, you know, and not that the Americans want something different than the Europeans or the Canadians or the New Zealanders and the Australians or the South Africans, really to try to gather all like-minded people also on Latin American continent to be really a voice to push global health, to push to be the voice for universal access to health. I think this is something political. But then the money we discussed already before. But I wanted also to mention a few other points. The social determinant was mentioned a lot. But in our trade policies, international trade policies, we should check that in every new trade agreement we have a social chapter and a gender equality chapter. We are now having a new trade agreement with Chile, where we for the first time also have a gender equality chapter in it. I think this is also very important. So in trade policies we can do something, because this is a purely European competence and not a member state competence, international trade. We can also, when it comes to migration, you know, we can also incentivize circular migration, and also to give an answer to the problem of brain drain or brain loss on the other side. This is a big problem, not only in Europe, but it's a global problem. We are attracting here a lot of medical services. Then Europe can continue funding community work. Community health work is very important. I saw it in the AIDS in my field, how important in Africa it is to have community health workers to go bring the medicine and bring the services to the people. So I think that is very important, and also that we invest in mental health, and this is something very important. We said it, psychosocial services are important, and I'm very happy that we have this awareness now within Europe first, in the European Parliament, discussing about mental health. That mental health, if you have a mental health issue, it's the same like my knee issue now. I have been treated, and I hope the treatment was good, and it will heal, and get this taboo away. And we have to start it here, and then promote this again also worldwide, that mental health can be healed, and it's important to link it to other health issues. And I think this is something which we should not forget. And then when it comes to migration, again, we had a debate this morning on the budget of the European Union, and there is some political forces, they want to invest European money to build walls around Europe. I think it's better to invest that money into integrating migrants and refugees, investing in health settings, investing in development, in ODA. And I remember I was in 2015 in Luxembourg, chair of the Foreign Affairs Committee, which also was dealing with development and cooperation. And I organized an interparliamentary conference with all the European Parliament, the Development Committee, Charles, you were there, and all the members of national parliaments, development committees. And we said, well, can you at least please go to 0.7%? We are not there yet now, in almost 10 years later. So here Europe also has to make an effort to do that. And then do homework. Europe has to do some homework too. And I was very happy that during the conference on the future of Europe, the citizens told us that they want more competences on health for Europe, for the European Union. We need more competences. And Charles is in the AFCO committee, which is the Committee for Constitutional Affairs, and they are working on a report on some treaty changes. And I think that also here we will, this is a difficult issue, but still to get more competences on health issues, I think that's also very important. And then it's not only a health issue, because we know it's also an economic issue. We know, for example, if you invest $1 in, for example, fast track strategy when it comes to AIDS, there is an economic benefit of $6.5. So when I went to Africa and they said with UNAIDS, I said, I do not only want to see the health ministers, I want to see the employment minister too, and and we discuss on creating jobs in the health settings. This is a great opportunity. I want to talk to the finance ministers that when they invest in health, they make their people more resilient, and they can work and they can bring in more money for the whole wealth of the country. And I think this is very important, that we don't only think in silos of health, but we go out of silos and we have a more horizontal approach, because if you have a population which is not resilient, that you cannot be successful as a country.
Thank you so much, dear Mark. And again, thank you for recognizing and your acknowledgement of the work of communities and the need to support them, to support community health workers, because they are the ones who are bringing services to TB-affected people as well, but to other affected people. I agree that the question of integration of migrants and the need to put more efforts and attention of it is very important. My own family is considered to be migrants in Portugal, so we recognize how it is important to have this a proper integration to the society, which is quite challenging for everyone. And my next question will go to Anton. As you've mentioned, thank you for sharing your personal experience. You're an HIV advocate as well, and you've mentioned about this need of universal approach. On your mind, why is it important to link this fight with a broader fight for access to health and to have a multi-sectoral approach? Maybe something you want to mention about the MAF-TB checklist and its commitment to accountability and universal health coverage as well.
So I think partially I touched a bit this HIV and tuberculosis connection in my first response, but just maybe to bring some more, evidence or facts. You know that until recent time, for instance, tuberculosis was 65% of AIDS-related deaths in Ukraine, it was caused by tuberculosis. And unfortunately, a number of my friends died at that time when there was no proper integration. That's why first word when we're saying about HIV and tuberculosis, it's always integration, and also like if we're expanding broader this health agenda to universal health coverage. Because first of all, you cannot deal with HIV and not dealing with tuberculosis, and vice versa. It's really, and as well as it's not just about these two diseases. When you have a person, and we say person or patient-oriented, person-centered approach, it's always number of issues we're dealing with, social, health. Even if it's health, it's not only these key diseases, whether it's tuberculosis or HIV or viral hepatitis. We know it's number, if you're a person who uses drugs, it's a number of, bacteriological, vein, cardiovascular, etc., etc. And it should be addressed at a certain point, because either you will fail in your key treatment of TB or HIV, for instance. That's why I think it's also, as I said, good proper time to address it within the universal health coverage agenda. I think what we also observed from this emergency and war in Ukraine times, it's also because you can, in my first response, I was telling more about my Ukrainian background, but also now I'm based here in Brussels and working for European AIDS Treatment Group, which represents the diversity of 2.3 million of people living with or affected by HIV and co-infections in the WHO European region. And we were really glad to contribute through our membership network and through our organizational capacity to help now initiative which Andrei raised, and to help people, Ukrainian refugees who's coming from Ukraine, fleeing from Ukraine to EU member states. So all these cases, which also Andriy mentioned, that people with tuberculosis and HIV trying to find access in EU member states, and sometimes we see that sometimes it's even more difficult, and mostly, why? Because of the stigma and discrimination and human rights issues which people faced with in their native country some time ago. And for instance, when they coming to EU member states and they try and the first need is to be registered as Ukrainian refugee, and then you are accommodated somewhere, they were so scared to disclose their status, whether it's HIV or TB or viral hepatitis or drug use substitution therapy. They were completely silent, and they were accommodated deep in provinces in some little small towns, villages, far away from access to healthcare facilities and to specific treatment. And then we received number of calls and cases, and my personal was dealing with these cases, like people were trying to find their way with 2 or 3 trains every day, for instance, to get this treatment. So yeah, so that's why I think it's a chain of things. So with human rights, we should work, and stigma and discrimination should be addressed for sure as a key focus in all these 3 high-level meetings, whether it's one political document, joint political document, or 3 different. It's really should be like a basics and fundamental things there. Talking about multi-sectoral approach, I think here is also Global Fund presented interesting case with CCM, country coordination mechanisms, where really different sectors, community, civil society, academic institutions, government, parliamentarians, they have their equal round table and voting voices, and where they equally influencing decision-making things. So it's I think this good example should be also replicated somehow and addressed within the high-level meetings. And finally, we talked a lot from the history of HIV high-level meetings, as well as after the first high-level meeting on tuberculosis in 2018. We always, as communities, were concerned about accountability, because again, brilliant, beautiful documents with really sometimes innovative, things, but then how to find out how to get the information and how to make your government accountable, that was always an issue and a problem. And that's why I think platforms like country coordination mechanisms or platforms, for instance, as your EU Civil Society Forum on HIV, TB, and viral hepatitis, where TB Europe Coalition, ETG, other partners are working together, and also hearing the voices of governments and UN agencies, that such platforms should be definitely the key field for influencing or contributing to high-level research.
I agree with you, Anton, that this need of accountability is a core to achieve any kind of success. And let's see how we will manage to do it during UNHLM 2023. My last question, and we will conclude the roundtable, will go to Diane. We hear a lot about the challenges in the fight against TB and the need for more investments in this field. Even though the last pledge, the Global Fund, has a huge success, though the investments to TB, it's not enough. It's always not enough, right? But after the COVID, the world is concerned about preventing the next pandemic and strengthening current health systems. On your mind, would investing in TB also contribute to addressing these concerns?
Thank you, Alessia. And the answer is yes. Of course, we've been hearing about why it's really important as a matter of justice and equity that we invest in TB. But it's also the smartest thing to do to build out a health system that really is universal. Many countries in the world have shown how building out a response to tuberculosis actually built out their health systems. Back in the 50s, many countries who were trying to eliminate infectious diseases were actually able to construct a health system that was responsive. And we have to do it not just for tuberculosis, which still kills 1.6 million people a year, but we have to do it because of the fact that it's one of the top reasons for antimicrobial resistance and the top killers of drug-resistant TB. As Vinciane has pointed out. So in order to stop the spread of what could be a very devastating pandemic of drug-resistant TB, we really need to intervene well now. And what we proved during COVID was actually those systems for diagnostics and treatment of TB were pretty resilient in testing for COVID. And whereas at first, at the beginning of the COVID pandemic, TB diagnostics and treatment fell away because everybody was focused on COVID. Once the system was able to adapt and co-test for COVID and TB at the same time, in fact, we were able to increase the notifications for TB immediately. So what we should really be doing is turbocharging our response to tuberculosis to build out the pandemic response systems. As Anton is saying, link that up. It's both universal, because if you can reach the most vulnerable people in society, then you have a really resilient universal health system. And secondly, it is practicing the kind of pandemic response that we may need in the future. So we think that TB is absolutely the key to both universal health coverage and pandemic preparedness.
Thank you for this encouragement and this conclusion on the good note that we need to make some concrete actions. And now we are going to the session of questions and answers. Please, our audience who are online, feel free to put your questions in the chat box. We will read it, even though we might not have time to read and answer on all your questions. We can follow up through email with you. Our preferences will be to our audience who are present here in person. Do you have any questions? Okay.
Thank you, Alessa. This is not quite a question, but rather a kind request. My name is Kira Grazava. I represent TB Europe Coalition. That is an advocacy network working in the WHO Europe region, but with a secretariat based in Ukraine. So we've drafted a formal appeal to key international organizations with a request to take necessary and urgent actions to protect the rights of Ukrainian people, including those affected by TB and the country's healthcare system as a whole that continues to suffer due to the ongoing war. TB Europe Coalition would be extremely grateful if committed members of the European Parliament would support this initiative by signing this appeal. The draft was sent to the organizers of this event, and they will kindly share it with you by email. So thank you so very much, hoping for your kind support, and special thanks to Delphine and Alessa for this opportunity.
Thank you so much, dear Kira. We are happy to share it with the Delphine's help, maybe. Thank you, dear Mark, for acknowledgement that this is important. Good. Any other questions? Oh, we need a conclusion remark. Okay. So please feel free to send your questions to the chat box. We are happy to follow up on this. But unfortunately, for now, we need to close our session and our discussion. Thank you so much to panelists who are present here and who are present with us online, dear Dan Bertun. Some keywords that need to be recognized, so that this event has happened thanks to the organizational support of Friends of Global Fund. And I must say that Global TB Caucus as well was recognized by the Global Fund as one of its most valuable supporters for political engagement. Also, because of the successful replenishment last year, there's a chance that it will enable us to get back on the trajectory toward ending HIV, TB, and malaria by 2030. But though we need more money for TB especially. We must ensure that TB care is available and accessible for refugees and migrants in Europe and worldwide. Growing migration in Europe follows an overall global trend, but the numbers have rapidly increased due to the war in Ukraine. The highest proportion of MDR-TB cases occur in Eastern Europe, so there is an increasing need to discuss how migration affects the health of Europe with TB and what should be done to support them. On behalf of partners and maybe on behalf of TB-affected communities, it will be a great chance, and we all will be very grateful if European Union parliamentarians will agree to champion an ambitious commitment for this UNHLM. We need renewed support for this UNHLM meeting, which will happen in September 2023, to reaffirm the commitment to the targets agreed in the previous political declaration and Helwell meeting, to get the world back on track to meet the 2030 NTB targets. Now more than ever, we need to strengthen international ties and work together in order to ensure a holistic, financed, accountable, and sustainable response to TB. Once again, holistic, financed, accountable, and sustainable response to TB. Mark Angel will have the hard task to conclude this rich event, so the floor is yours. Thank you so much.
Thank you very much. First of all, I would like to congratulate our fantastic moderator, Alessa, for the wonderful moderation, the good preparation, and we were briefed. So thank you so much for that. It's very professional, the way you did this, and also the very interesting comments you made. I've learned a lot from what you have told us today. Of course, thank you, Charles. Also, you said we have a responsibility. You took the responsibility, so thank you very much. As politicians, what I think was also important that you mentioned the high-level meeting in New York, which is coming up, because I saw what a change the high-level meeting on HIV/AIDS had an impact and how important that was. So this is very important and high expectations on that one. Then we had. I was very happy that Gabriela was there. She explained us the new European Global Health Strategy, and I think one sentence I remember is that she said we, as the European, has to have the lead also in communicable diseases. And I think this is very important. And also the research aspect, this will make Dr. Vassian very happy that research, we have to continue invest in research. And then Dan and also our Ukrainian friends, I thought it was very important that our two new candidate countries have been involved in this, and that we heard from the terrain what are the needs and the situation. I think this is very important. Dan, you mentioned that we need the awareness is a challenge, and this is important. You, Doctor, again, you insisted on the social determinant. I think that was, we all agree with that. That's one of the most important thing. And thank you also for updating us on the progress of the new medical, the progress in medical, in medicine, etc., and in science on this. And what I really appreciate from Andrew's presentation was that the last slide, it said Ukraine unbreakable against TB. And I think this is very, very important, and that you underlined how the collective effort is so important, the role of NGOs, of the communities, but also of the global and the international partners. This is also very important to name. And then I was so happy to see Diane again. And it's always a pleasure, and I love your English. It's so beautiful. And it was good to with your team, it was so beautiful to and not interesting also to hear that you operate in these difficult circumstances. And climate change with the natural disasters is not helping. The wars, etc., and that's 25% of the burden is in these difficult terrains. I think this is there we have to really also, when we do policies here in the European Union, we have to keep this in mind, that we send the funds to the right places, as you do it too. And then, of course, you insisted on the psychosocial support and also the migration. And then, Anton, it's always very nice to have a personal story, to have this témoignage, as we say in French, of that all the people here, the doctors, the scientists, the academics, the civil society represented, and maybe a little bit us politicians too, we see that there is a result in what is being done. The aim is to save life, and thank you so much also for your engagement and raising awareness. People like you are very important to raise awareness. Yeah, and then maybe to conclude, you said it, and I think that would be a nice word to conclude. Together, we must get the world on track to fight TB, and it's only together when we can manage it. And Charles, you brought the right people together. We have the responsibility to motivate our colleagues now in the European Parliament together, but not only the European Parliament, also get this message through to the 27 member states. This is also important because it's not only Brussels who can do it. We need all the other the countries, our colleagues in national parliament, our ministers, the council on board, because it's together that we can win this fight. And this fight is the same for HIV/AIDS, for tuberculosis, for malaria, and other diseases. So it's very, very important that we work together. So thank you once again. And unfortunately, I have to leave you now because I go to a very important, interesting meeting in the petition committee, where we have a petition where the petitioners want more better reconnaissance of the motives for asylum for women, for vulnerable women, and for LGBTIQ persons. And I have to go and defend that there as the co-chair of the LGBTI intergroup of this parliament, and also as a feminist. And you know, the anti-gender movement is very active, going against us, human rights defenders. We are not ideologists, we are just human rights defenders. And therefore, I just jump and put another casquette on in the other meeting. It's a pleasure seeing you. At my office, you can always call us if you have questions. And Charles, thank you for including me, for being inclusive. Thank you.
Pleasure.
Thank you. Thank you.
I'm sorry. Yeah, quick picture, and to recognize your work, dear Delphine, for everything, because these briefings were done by Delphine, and all
Okay.
preparations were done
Thank
by
you.
her. Thank you so much.
Teamwork.
Teamwork.
Together.
Yeah, together.
Yeah.